Hello, the following presentation, Electronic Health Records, Health Information Exchanges in HIE, is for you, the patient, to give more details into the advances in using technology in healthcare, as well as going over what a healthcare information exchange is, electronic health records, and how they impact you, the patient, and the benefit that they bring to you. What is an EHR is electronic health record system or electronic charting system that's used in healthcare as an upgrade to using simply paper. Many times now when visiting your clinic, primary care provider, or a hospital, you will notice that more computers, tablets, and other electronics are used to keep track of your electronic health record system. An electronic health record, or EHR, will be referred throughout the presentation. What is an HIE? An HIE is a health information exchange. It is the extension of the electronic charting system, or the EHR, where health information flows between providers, not under common ownership. One example of the use of an HIE is being able to access your patient information, your electronic chart, in a hospital, as well as that same chart being used by your primary care provider. An HIE is used to share test results, imaging results, medication list, discharge summaries, as well as your medication and medical history. An HIE increases the quality of care and cost savings to you, the patient, and both the healthcare system. An HIE is based on the premise that if providers have access to additional patient-specific clinical information, their clinical decision process will improve, and the ultimate goal of improving patient outcomes will be achieved. An HIE is an information sharing network that is secure and is a benefit to you, the patient. For you as a patient, as I mentioned before, you may start to notice or already have noticed nurses and healthcare providers that use computers, tablets, or other electronics to enter in information into your electronic medical record. One other change is that prescriptions can now be sent electronically to your preferred pharmacy, so no more sending you home with the prescription in hand that may get lost along the way. This is a secure connection between your provider, your hospital, or the pharmacy to transmit that information as a benefit to you. Is my health information safe? Yes, indeed it is. Data security and very stringent data security is required for all health information exchanges, as well as your electronic chart that resides at your clinic, provider, or hospital. Consent from you is obtained before placing your health data on the HIE, so no information will be provided to the health information exchange without your okay and your consent. As with data of any type that's electronic, the IT departments, your providers, and you also have to be very careful when placing information and monitoring data. As the patient, you are empowered to be able to monitor your health record and note any inaccuracies or errors in your health data. There are numerous benefits to you, the patient, by using a health information exchange, and those will be outlined here on the upcoming slides. A health information exchange can lead to reduced repeat imaging for you, the patient. When you visit various different clinics, hospitals, emergency departments, and different primary care providers, multiple tests may be repeated throughout your visits. With the health information exchange, your data can be stored. Recent imaging such as CAT scans, ultrasounds, chest x-rays, etc. can be reduced when that information is shared, depending on your presentation and your chief complaint at the time. An HIE can speed up care by allowing access and easy access to your health information regardless of where you are. It allows transparency, which also drives quality. Data is available during an emergency. For instance, if you visit an emergency department while you are away on vacation, your health information can be accessed by the providers in the emergency department when it is stored on an HIE. It improves the transition of care. If you were to move from an inpatient hospital to a skilled nursing facility, skilled rehab, or the like, your information data goes wherever you are. Protection of data in natural disasters. In the event that a natural disaster destroys health records that you have stored at home or in a hospital, clinic, or provider's office, if the data is electronic, that data will be saved regardless of what happened to the building holding that data. Better diagnoses and fewer medication errors are also a benefit that you, the patient, will experience with the use of an HIE. With all of your medical history, allergies, medical intolerances stored on your medical record and available to any provider that cares for you, better diagnoses and fewer medication errors is one benefit that you will experience. An HIE places the patient at the center of healthcare. Healthcare revolves around the patient, and when information is readily available, more focus can be placed on you, the patient, in treating your illness. It allows providers to be more efficient and effective. Access to historic information created by different providers is easily accessible. If you have multiple different primary care providers, a specialist, visits to the hospital, etc., all of that can be housed in one place, in one record, for easy accessibility. Referral information can be passed along seamlessly. If you were to be progressed to see a specialist, such as a cardiologist, respiratory doctor, any of those, your information can go along with you. It benefits the highly mobile patient. Many people across the United States move around quite a bit, work in various places in the country throughout different seasons, frequent travelers, etc. No matter where you go, your information is available. Or a patient with many or complex medical conditions, again, the access to the historic information is easily available for all of those providers that treat the patient. Reporting is one more benefit of the use of an HIE. This improves public and population health and is used to report contagious diseases found and immunizations delivered for a particular contagious disease. The sharing of this information may help different regions of the United States treating a contagious outbreak that is seen in another region. So information sharing, public health reporting is definitely a benefit for all. Quality reporting. Hospitals and institutions and different providers may be able to use this digital information to measure performance, again, to enhance the quality and efficiency of care. Can I see my information? Yes. Patients have access to their medical history, test results, and other medical information via a patient portal. The patient portal is simply a website, a secure website, with a logon and password that will be provided to you so that you can access your health information at all times. You can use the portal to communicate with your nurses and providers and easily track results and trends of your lab work and other imaging that's available and stored on the portal. And information about the patient portal will be provided during your visit to your healthcare provider. Looking forward, what does the future hold for HIE? Currently, there are several regional health information exchanges across the United States. The goal is to establish a nationwide health exchange to connect all of the regional HIEs. And providers have a very positive outlook on the future of HIE as technology continues to advance and becomes readily available, and the cost of the use of technology is able to be justified for institutions and providers. The benefit to the patients, the providers, is only going to continue to be enhanced. And that concludes the presentation. We hope this provided you information about health information exchanges, your electronic health record, and how the use of this electronic information helps you, the patient, live a long, healthy, and informed life. Thank you.